Good afternoon and welcome. My name is Dion Jones, and I will be your producer for today's learning experience. Thank you for joining the National Coalition of 100 Black Women Greater Cleveland Chapter for all you need to know about the COVID-19 vaccine, organized by the chapter's Health Committee and featuring experts from the Ohio Department of Health, the Cuyahoga County Board of Health, the Cleveland Department of Health, Metro Health, and Case Western Reserve University. Before we get underway, I have a few housekeeping rules. Keep your microphone on mute unless you are presenting. Disruptions are disrespectful and take away from our presenters' sharing of information and our guests from having an optimal experience. Participate, be an active listener. Place your questions in the chat for Q&A at the end. Take notes and enjoy today's session. And now I will introduce the Greater Cleveland Chapter President, Elizabeth Jones. She was elected as the National Third Vice President of Membership and Chapter Development at the 19th Biennial Conference in 2019. She is a servant leader and has been blessed with the leadership abilities, talents, and compassion to serve as a role model and advocate for Black women and girls. She wishes to utilize her life to advocate for others, believes those who have been blessed with abundance has a responsibility to help our disenfranchised members of societies and communities by using their talents and skills to ensure opportunities for everyone. I now introduce Elizabeth Jones, President of the Greater Cleveland Chapter.
Thank you, my sister, Dion Jones, for that gracious welcome. Good afternoon to everyone, and thank you for joining today's program. All you need to know about COVID-19, this is just so timely because I've been looking to get me an appointment, and it has been really difficult to find those appointment slots. I think I am on everyone's call list now, just waiting for that opportunity to come in. For those of you who are not familiar with the National Coalition of 100 Black Women Incorporated, NCBW for over 40 years has advocated on behalf of Black women and girls to promote leadership development and gender equity in the areas of health, education, and economic empowerment. Our vision is that Black women and girls will live in a world where social, economic inequity does not exist. I'm happy to say that the Greater Cleveland Chapter, we celebrated our 30th year anniversary last October. One of our major aims of our advocacy agenda is to ensure that the Greater Cleveland community stays informed about national and local issues, and in particular, those issues that will have a direct impact on their lives. Today, we are happy to engage in a discussion focusing on health, self-care, and the care of our families and communities as we all continue to navigate our new normal, living with the COVID-19 pandemic. Our expert panelists will provide information about the vaccine and the distribution process to help dispel myths. At this time, I would like to thank our presenters today for taking time out of your busy schedule to be with us, and the Health Committee for what I know will be a powerful and impactful program. And now I will turn the program over to our own coalition sister, Catherine Cosby. And Catherine, thank you for being instrumental in bringing this panel to us today.
Thank you, Madam President Jones. Excited to be here today. As you said, this is a timely discussion because we know that people have a lot of questions about the COVID-19 vaccine as well as the virus and how to protect themselves. Today, we are happy to invite panelists, as you mentioned before, from various departments throughout the state, as well as local to Cuyahoga County and Cleveland. And I'll have them introduce themselves individually, starting with Jamie Carmichael.
Hello, good afternoon, everyone. Thank you so much for having me here. My name is Jamie Carmichael, and I am the Ohio Department of Health's new Chief Health Opportunity Advisor. So we do a great job at really long names. So essentially what that means is that I'm responsible for promoting health equity across the state of Ohio and reducing those inequities that we see every day. My role is a new role, and it was created by Governor DeWine in response to recommendations from the governor's Minority Health Strike Force. The strike force was formed really in response to the devastating disparate impact of COVID-19 on certain groups, especially African Americans. And I'm going to talk a bit about that today. But if you have an opportunity to view the Strikeforce report, I would encourage you to do so. You can go to coronavirus.ohio.gov and search for our More Than a Mask campaign, and the report is there. But it really challenged us all to focus in a more meaningful and deliberate way on health equity and on the social determinants of health. So I am really, really happy to be here with all of you and look forward to today's questions. Thanks.
Thank you, Jamie. Next, I'd like to introduce Dr. Lynn Milner with the Cleveland Department of Public Health and Metro Health Express Care.
Hi, good afternoon, and thank you for the opportunity. I'm the current medical director for the Cleveland Department of Public Health and also the associate director for Metro's Express Care Clinics. Since the pandemic outbreak, I've also been fortunate enough to help man and staff Metro's COVID hotline. To date, we've taken over 40,000 calls about all things COVID, and I've been lucky enough to have participated personally for at least 10,000 of those calls. Been invited to several panels to talk about the vaccine, COVID updates. I'm just very happy for the opportunity to have a conversation with you. So thank you again for the invitation and the opportunity.
Thank you, Dr. Milner. Next, I'd like to introduce Dr. Shanina Knighton.
Hi, I'm Dr. Shanina Knighton. I am a clinical nurse scientist and faculty at Case Western Reserve University. Prior to COVID, my science focuses on infection prevention, self-management among patients in inpatient settings, particularly acute care and long-term care. So essentially just understanding or having a deep understanding about the public's lack of knowledge as patients regarding infection prevention. Since COVID, I've taken that information into the community in regards to educating them, not necessarily about what to do, but also how to do it. And likewise, like this esteemed panel, I'm very happy to be talking to you all today as well.
And last but not least, Dr. Pauline Tarabou with the Cuyahoga County Board of Health.
Hi, thank you so much for inviting me, and I'm here to represent the Cuyahoga County Board of Health. I've been working with them since the beginning of the pandemic as part of the response team. But I thought it might also be helpful to bring in some of my experience from the past. I formerly was an epidemic intelligence service officer with CDC in the influenza branch, where we worked a lot on preparing for pandemics and trying to also stamp out things that we were worried might become a pandemic. And so I thought that context might be a little bit helpful today to tell you about how things usually go when it's not a pandemic.
Thank you, Dr. Tarabou. So I think it's important to set a historical context about the COVID-19 situation and really why it has impacted the Black and Brown community in such a way. And so I'd like to start with Dr. Carmichael to talk a little bit about the COVID-19 pandemic and how it has negatively impacted the Black and Brown community and provide some historical context on that.
Thank you, Kat. So I have to first say Dr. Carmichael's my mom. It really is. But no, just Jamie is fine. So at the height of this pandemic, right, this summer, African Americans in Ohio made up about 13.5% of our state's population and represented almost 25% of our cases. And we also were much more likely to be hospitalized and more likely to die from this virus. And right now, African Americans are around 10% of the cases, but are still making up 18% of the hospitalizations, which is really interesting because that indicates to us that cases are more severe, or folks are having a more difficult time managing this disease without hospitalization. So this is not, however, unique to coronavirus and to this pandemic. Black folks and people of color in general in this country have often, we are the folks with the poorest health outcomes, right? So, for example, we know that in Ohio, Black babies are 3 times more likely to die in their first year of life than a white baby, and that Black women who walk into a hospital to have a baby are 2 to 3 times more likely than their white counterparts to never walk out again, right? So our maternal mortality rates are pretty high for Black women. In addition, we know that urban youth are much more likely to have uncontrolled asthma. We see them in the ER much more frequently than suburban or rural youth, and are actually much more likely to die from uncontrolled asthma. So the thing is, we know that we have clusters of poor health outcomes around the state, because the reality is that social determinants are really what's driving a lot of this health inequity. And so, that means that if I have diabetes and uncontrolled asthma, it's really highly likely that I live next to someone who has a similar challenge to me, health outcome wise. But that's not all we have in common. We have all of these other things about who we are, how we live, what we have access to, what our experience in our life has been, that makes us very similar. And so we know that these health inequities have been driven by racism. So, for example, redlining, the practice in the 1930s, after the Great Depression, America decided that we needed to have a better way of evaluating what was investment worthy and what wasn't. And so they sent teams out to communities to look at neighborhoods to decide which communities were investment worthy and which ones were not. And so often, communities that were more Black and brown were found to be less investment worthy. And that matters because that caused an actual disinvestment in our communities, right? So we can look at those places that were redlined through that process that actually didn't end until like the late 60s through the Fair Housing Act. But we can look at that and we can overlay now poor health outcomes, and it's almost a 1-for-1 match. We can see that where our government inadvertently maybe cause disinvestment, we see poor health outcomes. So I think all of that, not just that, but all of that kind of just made us really vulnerable for a disease like the coronavirus, right? A lot of us don't have access to transportation. Many of us work in frontline occupations where we don't have paid time off. We don't have medical leave. Many of us live in multi-generational households, right? Which we know is not great for spread, or maybe in multifamily households or in apartment complexes where there are many people in shared spaces. And so we saw this pandemic really devastate our communities. And I think that historical context is really important.
Thank you, Jamie, for providing that historical context. We definitely know that, consistently across the country, as you said, when you overlay the outcomes to the redlining maps, it's the same. And it also looks the same when you overlay lending and other investments. It looks the same. So we definitely see how that historical impact has shaped communities that we have today that are hyper segregated, and then also have high levels of poverty. I do want to have Dr. Knighton chime in on this. We had a really engaging conversation and passionate conversation about this yesterday, and really how This has, really become very political in the media. We talk about not only the health implications, but the economic implications of the pandemic, and just kind of, have you add in your perspective what Janine just shared.
Of course, I'm absolutely in agreement. I think one of the things that I've expressed that is concerning, and that's even as of right now, as we look at the vaccines, is the fact that you hear in the media, oh, Black people are disproportionately affected. You also see too, I would say, the mixed messaging that occurs in regards to the seriousness versus the not seriousness, even though we all know as providers, how serious it is. One thing that's very upsetting to me, and I think this is kind of, it's the historical context, and we can talk about the history, but even like right now, as we're in the midst of COVID, early on, how disheartening it was for individuals to call into emergency departments or use hotlines and be turned away. And 9 times out of 10, it'd be us that be turned away, knowing that testing, right? So we didn't have access to testing. We didn't have testing centers right away. So that also showed itself in regards to what we didn't have access to. Transportation to get tests, as Jamie mentioned, transportation being a big thing. But also too, when the tests were first rolled out, and this is what aggravates me when we talk about equity, is the fact that they wanted primary care providers to order the test. And if you know, us living in the city of Cleveland, a lot of individuals don't have a primary care provider. So that also presented a gatekeeper mechanism of not only can we get in and get treatment, not only can we get tests, we're being told to stay home. And I was expressing to individuals that the definition of telling someone with chronic conditions living in poor environments to stay home has a different context and meaning than it would for a middle class or upper class individual, which is, very disheartening. And so you look at these factors, and even not related to this, you think about PPP, so the money that everyone had access to, again, left at the bottom of the totem pole. And so now we're looking up and we've been hearing this message of, oh, it's fair, it's fair, it's fair. Everyone goes out and get masks. So you mandate masks, but you don't make sure that everyone in every environment has access to masks. And if you're recommending cloth masks, does everyone have soap and water to be able to clean their masks adequately and the resources? And so I'm constantly seeing it happen over and over again. And these things are not being put into policy to make sure that things are equitable. And then you're hearing on the news, oh yeah, Black and brown individuals are highly impacted. They're likely to be hospitalized. They're likely to die. But yet when the vaccines get rolled out, were we a high priority group in order to be able to get it? No, we started basing it off of age again. So it's like, at what point, does the policies and information there match the message? And that's very upsetting. And so again, I'm watching a lot of finger pointing happen, but it's like, at what point, does it become a true equitable conversation and more than just a discussion?
Yeah, I think that, can I just respond to that? Is that okay,
Sure,
Kat?
sure.
I think you're absolutely right. I think that we have many, many years of inequity that we've been trying to overcome in a really short time in response to this pandemic. But I do want to say that equity is at the top of our priority list in our response. And so, for example, we've provided hundreds of thousands of pieces of PPE through the More Than a Mask campaign, from the state level to barbershops, to beauty salons, to other small businesses, to childcare centers that we know are predominantly Black and brown owned. That was a major concern. We've also paid for major improvements in our migrant seasonal farm worker housing environments so that people could stay safe while they work. In terms of the vaccine, when the federal government came out with the initial phase 1B recommendations, they recommended, ACIP guidelines recommended 75 years and up. And it was an equity decision in Ohio to go to 65 and up because the average life expectancy for African Americans is 72.6 years, and for Latinos is just shy of 76 years. So in addition to that, the way that we're doing the allocation right now is based on the social vulnerability index. So 80% of what a county gets, because we did want there to be a vaccine option in every county, 80% of what they get is based on their eligible population, who we estimate is 65 and up, essentially. And then we get a 20% bump to every county that has high SVI. In addition to that, our goal right now is that because of the folks 70 or 65 and up in Ohio, about 17% of them live in highly vulnerable census tracts or neighborhoods. And so our measures are driving toward getting shots in the arms of people at a rate of about 17%. The same kind of equity measures are being applied for people of color. So right now, about 9.1% of the African American population is eligible under the 60 and up guidelines, and we're at around 6.5%. So we have a ways to go, but we're working toward it, and it's definitely central to our decisions. Thanks.
Thanks, Jamie. We're going to talk more about access later in the discussion. I do want to kind of take a step back and talk a little bit about how pandemics happen and how viruses spread. And so I want to ask Dr. Tarabou to, given her experience with dealing with pandemics, planning and outreach responses, can you give us a little bit of background information? I think a lot of people saw the movie Contagion, and that's probably their frame of reference, but can you kind of talk about real life, how that happened?
Yeah, sure. And I put together some slides. They're a little bit slightly on a different topic, but I'm happy to address that as well. Let me see if am I able to share my screen. I think it's disabled. Okay, great. All right. Are you able to see my screen?
Yes.
Yes.
Okay, great. Yeah. So what I thought might be helpful is to give a little bit of context for what goes on all the time behind the scenes that leads up to sort of having a vaccine, and how do we get to the point where we have that. So I was thinking, everyone's been to the doctor, but has public health come to you? And that may be a question you never asked yourself before a year ago, but clearly public health is in the headlines all the time. And so but we're not new to the scene by any means. And so for many people, the alphabet soup may have just started. They started to hear it in the last year from WHO, CDC, ODH, CDPH, CCBH. Who are all these people that maybe we just never even noticed before? And so I just wanted to sort of talk and kind of metaphor about things. And so, if there's a small fire, we call the local fire department, and the fire truck comes, and hopefully they're able to take care of it. Now, if there's a big fire, then there are, fortunately, they're not just scrambling to figure out what to do. The one truck doesn't come and say, uh-oh, I don't know, this is bigger than I can handle. In fact, all these agreements are in place before. So they have agreements with neighboring fire departments that if there's a big fire, there's a system where they all come together and they put out that fire. But then when you have something like a pandemic, then the issue is the whole world's on fire, right? And so what do you do? But what you are still doing is you're relying on systems and scaffolding that you put into place before. Even though we may just be hearing it for the first time in the past year, these systems have been in place. And so I used to give talks about pandemics to try to educate people that this is something we needed to be concerned about. And I would show some of these pictures here, and it would, be hard to relate to. And I look at these pictures now and I'm thinking, to people, does this kind of look familiar? Like we wouldn't have thought that a year ago, but these pictures from the 1918 influenza pandemic don't seem so strange now, right? So I wanted to, because we've always mostly been concerned about influenzas causing a potential pandemic. I wanted to sort of illustrate how we prepare for this with influenza as the example. So we had that big influenza pandemic that wiped out, we think about 50 million people died. And that was back in 1918. That was happening during World War I. But at that time, we still did not have we had never even isolated the influenza virus. That didn't happen until 1933. And then the first vaccine was made to influenza in 1938. And that was a lucky thing because it was used for troops and protected them during World War II. Well, after World War II, the United Nations, right, were founded to sort of sort out a lot of international problems. And part of the United Nations is the World Health Organization. So that's this international body. It was founded, and the whole idea is that some things, are a problem somewhere is a problem for everyone everywhere, and we all have to work together on health. So in 1952, what was founded was the Global Surveillance and Response System for Influenza. And here I'm showing a map. This is from this past year, and all these little dots are all these centers all over the world that work together. And then there are 4 major coordinating centers in different parts of the world. Ours in this part of the world is in Atlanta at the CDC. And so this infrastructure existed. And so this existed long before this pandemic. And what do? Well, and now kind of I'm going to take a step back simultaneously. So the WHO started, right? And they founded this surveillance system for influenza. Well, the CDC, it had been what was a malaria control unit during World War II down in the South, because malaria was actually down there. Well, it became the CDC in 1946. And so these two, so we have an international group and a federal group, and they've been working together. So what does CDC do? So every year it is doing so much work behind the scenes. So it has this whole network of when people go in and they're sick, they have these providers who, for a subset of the people, they'll collect a nasal swab, and then they'll test it in clinical labs, and then some of those labs get sent to CDC. So more than 1 million specimens are collected. 100,000 are tested in public health and local public health labs. CDC sequences about 7,000 of them. And then about 2,000 to determine what they look like in the immune system, and then 50 are prepared for possible vaccine production. And that happens every single year. And that's the scaffolding on which this process that we've done for coronavirus has happened. So it didn't just come out of the air. We've been doing this year in and year out. So then this amazing thing happens. These specimens are collected in the US, but they're also collected from all over the world. And then they get together, this panel, and they say, well, what's out there circulating? What do we think might be circulating in the coming year? Because as you know, we update the influenza vaccine every year. That's a big deal. And so then they make a recommendation, because influenza is usually in the winter. They'll make a recommendation around this time for next year's vaccine for North America, or I'm sorry, the Northern Hemisphere. And then in the fall, they'll make that recommendation for the Southern Hemisphere. So it's this amazing, coordinated system that works together to figure out. So that everyone's doing surveillance all over the place. You put these things all together and you work in a coordinated way. Well, then in the US, After that recommendation is made, it goes to the FDA, and the FDA is another government agency, but it has to approve it for it to be able to then become this year's vaccine. But then who makes the influenza vaccine? Does the government? And the answer to that is no. We have to rely on the manufacturers, the pharmaceutical companies. But government, the WHO and CDC is working hand in hand. It's this incredible process for influenza vaccine. You've got to first, figure out what you're going to put in it. The FDA has to approve it. Then the chickens have to lay the eggs. You've got to grow it in it all. And then you've got to ship it. So this is this amazing system, and this is happening year after year after year. So that I wanted to give you context. So that's how the world works together. So when we think about this as being a vaccine that happened quickly, yes, but we didn't just fall out of the air. The other thing I wanted to say is one of the other big roles that CDC and WHO and those other entities have is to detect things that might become a pandemic. And so here are some things that I was involved in directly. At the top in 2003, this is SARS. So that is the coronavirus outbreak that started in Asia and spread out to a number of different places, but we had a vigorous public health response, and it was a little bit different, and we were able to contain it and prevent it from becoming a pandemic. I also was part of the response in West Africa to Ebola. Again, people were worried. If Ebola's here, it was the largest outbreak, and the concern was, where is it going to end up? And so this coordinated response, WHO, CDC, and all these other groups were able eventually to contain that. And we here in the United States, remained healthy and safe as it relates to Ebola. Then in 2012, this is MERS, Middle Eastern coronavirus. So that was also a similar coronavirus. And again, big response, and it was contained. So then you kind of go down the list, and ODH, because I know that's well represented here, just to think about it. So the state level, so WHO and CDC are out there kind of figuring things out on the global level, big picture, and then you come down to the state level, and that's really where a lot of the laws go. So you'll say Governor DeWine made this decision. So we must report this by law. So that happens at the state level a lot of times, those public health determinations. And then we come down to the local level. I, in fact, pulled this out. This is the influenza surveillance report from 2011, just to say, again, we've been doing this for a long time. And, monitoring, tracking, reporting. And now everyone's seen this for coronavirus, and it may not have been such a hot topic for influenza, but again, we've been doing it. And then next, that's really where, now that I've had the privilege of working on the local public health level, that's really where the rubber meets the road, because that's where they really know the details of the community. And so you take something that you're coordinating from the whole world, and then you bring it down to that scale where you say, what are we going to do with the homeless people who have COVID? Can we find a hotel where they can stay while they're recovering? That's what's happening at the local health department level. How can we reach vulnerable neighborhoods? Should we go to the Word Church and set up testing there, because that's going to be a place that people can get to? We're taking all this big thing and bringing it down to really one-on-one person level. But then again, because the fire's happening everywhere, it doesn't just happen with public health. And this is a response for everybody. So the hospitals are involved, the school districts, social services, community services, just everybody. And we're all working together. But what I wanted to really emphasize is that the development of a vaccine and figuring out the right vaccine is a coordinated process that is happening all the time. And it's a wonderful opportunity to have it here for the coronavirus now. Right, and that's it. Thank you.
Thank you, Dr. Tarabou. I think, that's one of the many questions that's been asked about the vaccine and how quickly we were able to get something out, given what's happening around the world. And so if I understood you correctly, you're saying because vaccines are being developed all the time, and we're building off the knowledge of previous vaccines, it helped us to be able to expedite a process for developing the coronavirus vaccine.
Right.
And we'll continue to learn from, as we get more data about this vaccine, we'll continue to learn and continue to further improve on what we've learned in that process. Is that correct?
Right. And also very importantly, the surveillance, so the disease surveillance system. So monitoring for, who's being affected, which strains are out there, the labs that can collect the specimens and test them, all of those systems, while it's being focused now on a coronavirus, those systems exist because these networks were built for other things as well. And so it's like a road that serves one purpose one day, but you need that road to get other places at other times. And so it's really being built on a very solid foundation.
So one thing I do want to ask, we're starting to hear, and we'll talk more about the vaccine as we move forward, but we are starting to hear that as the vaccine is rolling out, we're starting to get these different variations of the virus. And so how does that play into developing or strengthening the vaccine?
Yeah, and again, so the vaccine, making a vaccine is something that's done sort of the public side does the surveillance side, and the private side actually makes the vaccine. And so the public health side is monitoring and figuring out what variants are out there. And then the public health labs are helping to ascertain kind of what the trends are. And then that gives the opportunity to then hand it off to the manufacturers to make adjustments. And we don't really know what's going to happen or how the coronavirus vaccine may or may not need to be adjusted over time. Chances are it will. It changes over time, coronavirus more slowly than flu, but the flu shot, is updated yearly. And again, this is different. It's a different virus. It has different properties, but that whole idea that over time we may need to update it, that's a pretty familiar one.
Thank you. So I want to move to talking a little bit about the state of COVID, both at the state level and the local level. And so, Jamie, if you could talk a little bit about what's happening statewide with COVID. We know that we're starting to hear more about the numbers beginning to decline. And then if Dr. Milner can talk about what's happening at the local level in terms of the data.
Yeah, so we're definitely seeing a decline in the number of cases, hospitalizations, and deaths. I think interestingly enough, we've also seen a severe, like not severe because it's a positive thing, a sharp decline in the number of flu cases this year. We've had, very, very few compared to other years. And a lot of that has to do with a lot of the preventive measures that folks are taking, to prevent contracting the coronavirus or spreading the coronavirus. So I think, we're in a good place. We're still, seeing a spike now starting to ripple out into the rural areas. They're kind of on the tail end of this. As I mentioned, I think in the African American community right now, we're at about 10% of overall cases, and but the number of hospitalizations is way down. So, yeah, I think we're headed in the right direction, and the vaccine will just help us to get there, and hopefully stay there. So, yeah.
Dr. Milner, if you could talk about what's happening in Cleveland.
Sure. So it's a pretty similar trend. We're really encouraged and excited that the numbers are starting to level off to a point. It's encouraging that, as you know, if you look at the state map, where everybody was red at one point, there are actually some spots of orange now. So that means that the numbers have continued to decrease. One of the drivers for that number is the number of patients that are hospitalized with COVID, how many are in the ICU or on ventilators, and some of those numbers have also trended down. The guesstimate about the positivity rate in and around Cleveland, Ohio is somewhere between 10 and 12%. And there was a time, that's probably the darker time where we were well over 30%. So it's been a while since we've seen that. So we want to see that trend continue to decline. As you know, the governor, to his infinite wisdom, or you can judge that how you like, came up with when we get to a certain number of cases per 100,000, that's when we start talking about lessening some of the restrictions. And that's all very vague, but I can tell you that we're very far away from that. And we don't know when we'll get there, right? So I think in estimation, it's good to have an end goal in sight, because I think people are frustrated and tired of being in and restricted. So knowing that there is a light at the end of the tunnel is helpful. We're still in the tunnel, but we're very encouraged by how we're seeing the trends. And if we can just keep the trends going down, and not turn into another spike or surge, then I think we're moving in the right direction.
I keep forgetting to unmute. Speaking of lessening restrictions and the recent announcement by the governor, first, Jamie, if you would talk a little bit about that recent announcement, and then from there, I'd like to go to Dr. Knighton and Dr. Milner to talk a little bit about what are some preventative things that we can do to continue to keep those numbers down. So first, Jamie.
Sure. Thanks, Kat. So the governor did do an address, kind of a primetime evening address earlier this week, where he talked about setting a threshold of 50 per 100,000 cases, that when we get to a point where we're at 50 per 100,000, then the current health the health department orders that are out there right now, required mask wearing, some of the other things that impact businesses and event centers and restaurants, will be lifted. So that was the big announcement. There was also an announcement yesterday impacting the Cleveland area specifically, that we are partnering with the Biden administration to offer a mass vaccination site in Cleveland at the Wolstein Center. And we're anticipating vaccinating around 6,000 people a day through that effort, 7 days a week. And so that will kick off in mid-March. And I'm sure that many of you will hear more about that from your local health departments and other partners in the area that we're working with to make sure that we have access. I think I will say this real quick about the mass vax thing. When we looked at other states with mass vax, they don't do a great job of reaching vulnerable people or Black and brown people. And so it's going to take a concerted effort for us, and it is kind of central in our planning around how do we reach underserved communities and get folks to this mass vaccination site and remove any barriers related to transportation, or the amount of time that they may need to take off from work, or thinking through all of that. So those were the two big announcements this week.
Thanks, Jamie. So Dr. Knighton, during our conversation, we talked about the importance of preventative measures during, or now as we're in the midst of it, as well as even though vaccines are available. So can you talk a little bit about what are some of those things that we should be thinking about, and then also even talking about the double masking, because we're starting to hear about the double masking and whether or not that works and what that should look like.
So first and foremost, I want to say that this is the beauty of science, in that you're going to find information that is definitely going to support it. There's going to be, of course, against. You have a difference of materials that plays a factor. And so one thing I can say for sure is I know that when we're talking about cloth masks and we're talking about double masking cloths, that is so widespread. Meaning, for example, we've done studies, there's studies on surgical masks, there's studies on, N95s. But when we're talking about cloth masks, if I said, Kat, use your sweater as a mask and you chose to double that up versus taking a tea cloth, like a towel, a kitchen towel, and deciding to double that up. Our particles that would be able to get through that mask is going to be different. It just is. And so one of the things that I can say, I understand that, Dr. Fauci at some point, said, okay, double mask up, then it was not double mask. The recommendations are right now, and even what we're doing in clinical settings, is we're giving patients a surgical mask. We're not giving them two surgical masks, we're giving them a surgical mask. And if worn correctly, the goal is for when they have it on and the blue side is facing out, it is to keep whatever particles inside of the mask. So it's not to necessarily protect potentially what comes in. Something else pertaining to masks, and I know individuals are not talking about this a lot, but it has been a concern, is the laundering of masks. I constantly get questions about, well, how often should I be washing my mask? And it's every day. And so I always tell individuals, change your mask like you're changing your underwear. We are mouth breathers. We have bacteria in our mouth. We have bacteria in our nose. And so many don't think about the fact that your mask can become wet. And think about what happens. We all are aware of mildews and we're aware of molds. The only thing that we're not just fighting coronavirus here, we're talking about other forms of pathogens that can also be harmful. And so it is highly recommended that individuals are washing their masks daily. I do not suggest that people let up, with their hand hygiene practices, especially while being out in public, being conscious of what it is that you're touching, elevator buttons, touching rails. Like, these are things that we don't think about, but we have to definitely make sure that we're still keeping them up. Our third hand. So I call our cell phones our third hand because we sit them down on counters, we put them up to our face, they're up to the mask, we're touching them with our fingers, trying to text someone. And when you think about how much you're practicing hand hygiene in between touching your cell phone and what you do with it, you would be surprised how many germs it has on it. And it's even found that cell phones are 10 times dirtier than the toilet seat. So they've been swabbed and they've been tested. And so as these measures continue to be lifted, but as Jamie mentioned, when we're looking at decreased flu numbers, why are we looking at these numbers? It's because for once, in my present history, we have employers that are telling people to stay home if they're sick, where before you would be fired if you stayed home and it didn't matter if you were sick because it might have been deemed as being an excuse. So I'm seeing that, also too, when we're talking about just the numbers going down, it's because of these measures that are put in place and that people are practicing. And so my concern is that everything people say, oh, well, I got to worry about washing my hands as much. And we see this in healthcare. So this happens in hospitals. So, hand washing all of a sudden start declining again. Mask wearing, individuals that are sick and know that they're sick, making sure that they're conscious that they should still be wearing a mask if they are ill, because we know that those measures are going to let up. The physical distancing. So it's just so many things that we're getting ready to see happen that, unfortunately could yield unintended consequences. And I know that we're not going to talk about the vaccine just yet. But even still, when we're talking about prevention, we're talking about rollout, we're still talking about individuals that may have some sort of cold symptoms, after taking the vaccine. Droplets are still droplets and your germs are still your germs. And so being vigilant about keeping up mask wearing, even during that time, making sure you're practicing hand hygiene is going to be essential. And I always tell individuals that while there are the majority of people that can get vaccinated, there are going to be individuals that absolutely just can't. And so you want to make sure that we're doing measures to make sure that we can protect those individuals that can't get vaccinated. So these are all things that are very important. Even hand hygiene with jewelry, making sure that you're cleaning up under your rings. That's not something that individuals pay attention to. So I'll be honest, a little bit concerned as things continue to get rolled back. meaning that we're going to see many leveling degrees of what that rollback looks like. In terms of, does everyone just go back to 2019 or pre-pandemic and say, okay, we're just going to have like big parties and do everything as if the pandemic was never here? And then too, even now, just we know that the vaccine lasts for 6 months now. So is it a situation, and just as Dr. Tarabou mentioned, whether we're talking about mutations, whether we're talking about just the length of time that these antibodies will protect us for, will we be in another phase of where we'll need a booster, but it's too late because we roll back these practices? And so I just tell everyone prevention is better than treatment. Something else to still think about is, COVID-19 still has long-term effects, like just in general, we're starting to see these. And so I would still make sure that people are taking those measures just to make sure that they're not on a bad end of receiving those long-term effects. I'm even knowing women that have their hair has fell out, or it's falling out in patches. And this is something that's often not talked about, but it is happening.
Thank you, Dr. Knight. That was very informative. I think that there were some points that you made that people may not have even considered, and I'll be sure to remind folks on some of the things that you talked about, particularly around the cell phones. I saw Jamie's face frown up a little bit because I've not heard that before. So thank you for sharing that. I do want to switch gears a little bit. I'm sorry.
Sorry, just really quick, because I have to say this. So, and this is such a thing, but I know some of us eat fast food, but I have to share with you this experience because this is something that we don't think about. So one of the things I know that drives me crazy is that the individuals at most windows of a fast food restaurant have gloves on. They do not change those gloves. This is the individual that is dealing with your plastic. That plastic car is very contaminated. So when I mention I study infection prevention, I'm not only just studying it from the research side with patients, I'm actually in the lab, like swabbing stuff and having fun and looking at what bugs grow. And so cards are nasty and those gloves are nasty, and many people take them on thinking that the gloves are their hands. Hand washing is the most safe thing that you can absolutely do. But what they're doing is they'll literally take your card, like they've taken hundreds of cards before with these gloves on, because they're thinking that they're protecting them. They give you your card back again, which picks up germs. And we know that even if COVID is on there, COVID loves plastic and can last for up to 3-4 days. And then on top of that, they fix your beverages. And they take those same gloves, and we know that you have to put the lid down on your beverage, right? So they then take those gloves and they smash your lid down. So they've now taken all of those germs and they set it directly on top of your drink. I've even seen an instance where, how with our kids, if you're grabbing 3 drinks, you put your hands in the cups so you can carry all 3 over. I've watched them carry all 3 cups over with gloves on, touching the ice to go fill it up with fluid. So when I mention it, not only just us being careful about our infection prevention, it's also being aware of when you are in situations like those, what is someone doing that could potentially make you ill? Because a lot of times when it's a stomach ache, if it's, that ain't taste right, or that food didn't sit right, it's 9 times out of 10 not the food, because that's been cooked at adequate temperatures to kill whatever. It's probably what happened in results to preparing your food and the unsanitary practices that happen in between. And so it's just instances of when you're out to think about what others are doing that could harm you or potentially keep you safe. And that was it.
I'm really not sure how to respond after that, except for I will limit my fast food intake even more than I do now. So with that being said, Dr. Milner, I want to switch to vaccines and really, talking to our participants about how do vaccines work. So we have this virus, we've been doing all of these preventative measures now. Dr. Knighton talked a little bit about this 6 months of protection. How do vaccines work, and how are they potentially protecting us from viruses?
Sure. So at its most probably simple level, I look at vaccines as a message to your immune system that something is foreign that you need to fight off. So it was actually really informative to have the history lesson, because I think that's one of the challenges in the COVID vaccine rollout, about information about this was brought out too fast. It was rushed to production. Obviously, the technology for vaccine and vaccine development has been around longer than most of us have been alive, right? What we are privy to now is literally almost every step of the process. So what we are made aware of looks like, oh my gosh, you just did this in X amount of time, when the science behind it has been around for years. What got pushed ahead, though, was the red tape to get the vaccine out. Now, I still have a smallpox scar, but I can tell you that I was not knowledgeable enough or old enough or had access to the information that gave me all the steps about how that vaccine was developed. Now we have that information. So what looks like a faster course is actually really not. What scientists had done was wait for the actual protein that they could use to develop the virus that would make our immune system work. So I always say it just in the simplest terms I can, a vaccine is a measure to try to prevent you from getting serious disease from an infection, or prevent the infection at some level, right? So people want to get caught up on what's the effective rate of the vaccine. So as you know, the two new COVID ones are 94 to 95%, and the Johnson & Johnson is around 72%. And people will, Jamie and I had this conversation the other day, people will look at that, oh, well, it's 90 for this one and 70 for that one, so I'll pick and choose which one. But the flu vaccine actually is even much less effective than the Johnson & Johnson. So numbers are important, but they're not the entire picture, right? The picture is how much getting the vaccine can prevent you from getting infection, and not just infection, but from getting severe consequences, being hospitalized, being on a ventilator, or heaven forbid, dying. So the important thing to remember is that all the vaccines are effective at preventing that severe infection that will lead to your death or lead to an ICU admission. And it's important to remember why we encourage people to get vaccines. As we know, there are a number, and I think President Jones said, I want to get my vaccine and I can't get it, right? So we recognize the challenges to getting it. And we know a lot of people, the why is easy. So the why I want to get it is because we want to go back to doing the stuff we want to do. We want to have big parties. We want to play bid whist. We want to have book club. We want to go to weddings and funerals and baby showers and travel, right? So this is one way. And we also know that not everybody will be able to get it. Not everyone will want to get it. So to Shanina's point, that's why you cannot take your foot off the gas when it comes to your hand washing, when it comes to your masking, when it comes to your distancing. You have to continue to do those measures, or else we take steps back, right? I call hand washing old school hand sanitizer. What did we do before we ever had hand sanitizer? We used soap and water. I mean, hand sanitizer is a new thing. You see people trying to sell hand sanitizer at the height of the pandemic for, $40 a bottle, and it was off the shelves. All you had to do was buy soap and water and use soap and water. I mean, it really is not any more basic than that. So I'd want to spend a couple minutes on vaccines, and then we can go to questions and whatnot, but do know that the science behind the vaccines is tried and proven, and it's important to trust the science, not the emotion, and not the the information you got off of Facebook, or your cousin Ray or Aunt Sadie or Becky said this and my cousin had that. I mean, I'm not trying to throw relatives under the bus, but we all listen to stories and we all hear stories. So some of that information is accurate, some of that information is not, but we want you to trust the scientists. And it's important to have the message given to you in different formats, but from people you trust. Your healthcare providers, your faith leaders, your people who have done the research and the legwork so that the information you get is important and up to date. I like forums like this because they're conversations, right? These are free forums where you can ask that question, get that information, and we can all attest to there's not a lot we haven't heard, but we want you to have the information that you can take back. So when you're asked, or somebody asks you, why did you get the vaccine? That's an easy question to answer. The other one's not as easy. So the why not? What's your why not? Do you think it was rushed? Do you want to let other people get in line before you and see how it goes? Right? Did you have barriers to access to get the vaccine? Do you want the vaccine? Do you meet criteria and you can't get a job? Or heaven forbid, you live in a digital desert, right? You still have a flip phone that doesn't have smartphone access. You can't get to the internet. So we need to be mindful of all the challenges that prevent us, in addition to what we know are common myths. And we can't assume what one person's reason for getting the vaccine is every person's reason for getting the vaccine, because it's a complicated picture and there are a lot of reasons for why not. And I think what we can't do is tell people, oh, you have to do it, you must do it. Thankfully, we're not at a time where this has been tied to your employment, because we're not there yet, but that time may come. So what do we do when someone says, oh, well, you don't have to get the vaccine if you don't want to, but you can't work here? And that sounds odd and that doesn't sound right, and it isn't right, but we may get to that point. So we need to do everything in our power to recognize those challenges, not just for us, but for our most vulnerable, right? And make sure we exhaust every challenge that's put in anybody's way. We encourage you to get the vaccine because it's important. We want to go back to whatever life is going to be like post-pandemic, and there will be a post-pandemic. And we just don't know what that's going to look like right now, but we're going to get to that place, but getting everybody to a better place is the most important part right now.
Thank you, Dr. Milner. And I would encourage anybody that's watching, if you have questions, either put them in the chat or on Facebook, or you can put them in the chat on the Zoom chat. I do want to turn it over back to Jamie to talk a little bit about what we can expect as it relates to distribution. And I know we're starting to get more access to vaccines. So if you could talk a little bit about that, I think that would be helpful.
Yeah, no problem. So the vaccine allocation access process has been extremely frustrating for many people, including for myself, trying to get my loved ones who qualify access. I think a couple of things. One, up until this week, we were dealing with about between 120, 150,000 doses a week for an eligible population of like 2.5 million. And so that supply demand ratio just made it really hard to get vaccine. In addition, it was hard for us to put vaccine into certain places because of some of the requirements around how it has to be stored and handled, and the fact that it can only be shipped in 100, dose packs. And so that meant anyone that we gave the vaccine to needed to be able to turn over 100 doses in a week. And so that really limited a lot of where we could go, especially in urban and in rural areas. And so we partnered with the federally qualified health centers, and there are about 120 of those around the state. And just by the nature of who they are, like who you have to serve to qualify as a federally qualified health center, made them a really ideal partner to target high risk groups of people, right? Because they serve mostly low income, a lot of people of color, a lot of very rural communities. And so we kind of use that as one layer. Then we brought in the pop-up vaccination layer. So some of you may have seen some pop-ups in Cleveland that were a couple of weeks ago. We're working with the health department, the Cuyahoga Health Department, to do a pop-up in East Cleveland. That's kind of, I think, maybe a recurring pop-up. So we're providing those kinds of opportunities through the National Guard. And then on top of that, some targeted stuff around senior housing and low income senior housing. So we're doing about 9 to 15 senior housing units, just driving up and vaccinating people. And so that really has not been adequate, right? We've tried to layer on all these strategies to get to the most vulnerable people, but we all know that it was still really hard. Your president started out with saying, how in the heck am I supposed to get this vaccine? Now that we have the J&J, the Johnson & Johnson or the Janssen product, that really has loosened up our supply chain significantly. So we had like 400,000 doses this week, which more than doubled what we had been getting even at our, at the highest point. So what you'll start to see is more availability through your local pharmacies, because now we can start to partner more with small independent pharmacies, because the Johnson & Johnson product is a little more flexible in how it can be stored and all of that. It allows us to do more with mobile vaccination. It allows us to do even more with our pop-up strategies. So right now, every week, the federal government tells us how much vaccine we're going to get, and we have 2.5 days to decide where it's going to go. It is a very stressful and intense process every week, trying to say, okay, we're going to go here, here, and here. And what we're doing, just to give you context, is we have a big map of the 700 most vulnerable communities in the state of Ohio based on the CDC's social vulnerability. And we look to see where are there gaps. And if there are gaps, we try to send allocation into those communities if there's a provider. But a lot of our communities are healthcare deserts, right? And so if we don't have a healthcare partner that can handle the dosage or that we can send to, that's how we decide where we're going to try to place pop-ups every week. But all of that should start to loosen up. So not in addition to the 400,000 doses we got this week, we have, hopefully we will continue to get vaccine at a similar rate in coming weeks. In addition to that, the federal government in their announcement yesterday said that they're going to take out of the federal vaccine supply what's needed for the mass vaccination site in Cleveland. So those 6,000 doses a day will be in addition to what the state is already getting and pushing out. So we're doing that. And then we'll also be setting up mass vaccination sites in, I think, 11 other areas around the state. We'll continue with the pop-up vaccinations. We're trying to bring more primary care folks in because now, like a normal primary care doctor doesn't have the ability to store Pfizer. They don't have ultra cold storage. So we've been trying to figure out who can handle the throughput and try to make this more available to everybody.
So I'm raising my hand in real life, Katie.
Go ahead,
Like,
Doctor. I just got a message. I'm sorry I missed you. Go ahead, Dr. Knighton. I'm sorry.
hey, and so this is honestly the perfect segue, Jamie. So right now, so my clinical students are actually out there right now. So we're doing the pods with vaccine administration. And naturally, I have individuals that reach out to me about their experiences. So of course I get questions of should I take it? Naturally, I'll tell them to talk to their provider, and it's been interesting because I actually I don't share my vaccination status on purpose. So I'll educate. So you hear how I'll educate and I'll advocate for it, but I don't share. And it's for multiple reasons. One, I've encountered situations where there are people, and this is where I say equity, fails us again, in that there are individuals that want to be vaccinated, but are caregivers to others at home and are in a situation of where they fear getting the symptoms, even though they might be mild and may need to be off of work for a day or two. And having to take care of someone, there are individuals that they don't have the time off. So they don't have paid time off to, which again, Johnson & Johnson is great because it would be just a one-stop shop kind of thing. But these individuals didn't have time to say, oh, I'm gonna take off for the first dose, deal with those symptoms potentially, and then also take off for the second dose and deal with those symptoms. There are employers, even though we are up under emergency use authorization right now, I know people personally, 2 individuals reached out to me because they've been fired from their jobs because they got COVID. So they got COVID, was told that they needed to file unemployment, okay? File unemployment, and then was told, well, once you get your 2 negative tests after having COVID, you can't come back to work until you get a vaccine. These are individuals that work in healthcare settings, but now that they're not employed anymore, they're no longer a part of the 1A group that will qualify for it. I'm seeing individuals that don't work in healthcare settings that want to get the vaccine, and employers are saying, if you are off of work at any point, I'm not paying you for that time off. And so while I hear a lot of conversation around the topic of distribution, around the topic of access, there are still these issues of inequity that are not being discussed. And while I know we did not put together that stimulus package, it would have been nice to see some paid time off buffered into these packages to pay for individuals to have time off to be able to go get vaccines. It would have been nice if someone is a caregiver and they chose to be vaccinated to protect, the vulnerable individuals in their house, well, where's the caregiver support? We're going to give you transportation vouchers to make sure that you can go get the vaccine. So I see still all of these things. It's like these same issues that we had early on with testing, with, PPE, with masks, is continuing to be precipitated now because we're thinking about access from an overall standpoint of the vaccine being a silver bullet, but not these factors that are around it. And that's the thing that I'm seeing us still continue to fail our people on. And I don't have all of the answers, but I feel like we have more resources and we just don't utilize them for the best of being able to get people what it is they need.
Yeah, I think that's right. I think that there are a host of barriers for all kinds of people. In our rural communities, transportation is a huge barrier. And I think the idea of paid time off is another barrier. We've been working with our providers of the vaccine to issue guidance, or we've issued guidance now twice around flexible hours and offering vaccine and off hours so that people can access the vaccine, and making sure that they have some variety there, right? Because we don't all work Monday, Friday, 8 to 5. I don't, clearly. I'm here on Saturday. Um, but I think, we are, very aware of that. I think too, um, this is where community organizations like this one, and maybe organizations that you all, with 100 Black women, this is where organizations can really be helpful. So what I've been telling folks is, look, we know that registration is a huge barrier. Registration, because people either don't have the right kind of device. Like I tried to register my parents on my phone and I wanted to throw the phone across the room. It's not, and I'm like pretty tech savvy. I'm not super young, but I know how to use the internet, right? So a lot of people don't have the right device, or they don't have broadband, or they don't have, they just don't want to fool with that. And so we've tried to open up now our call center so that they can get help getting those appointments without having to do it themselves. And we're bringing on a vaccine management system that should be up here and before the end of the month. That'll be a centralized system so that you don't have to go to each provider and hunt and peck. Like I'm going to check at CVS and I'm going to check here, I'm going to check here. It'll just have all of the availability. So trying to get at some of that. But what I've been telling community members is, is that something that you could do? If you have a relationship with that community, take your iPads and go and out and offer to register people. Set up a booth at the back of your church at the end of service if you're still having in-person service, and let people come up and you walk them through that process. I think that there are a lot of opportunities for community organizations to help. Transportation's another one. We're working with a number of faith-based organizations, especially in rural areas, to facilitate, because they have transportation for their churches, or temples or mosques or whatever the faith. But how do we leverage that as a community while it's hard to meet every single gap as a state agency, and it's hard for the local health departments to be as flexible as well. But if we partner together with the state, the county health district, the city health district, and those community organizations, I think we can remove uh, a big chunk of those barriers. And we're certainly thinking about that, and when we're establishing policy, right? So, for example, I heard from my Latino brothers and sisters that they were nervous about what kind of documentation was going to be required to get this shot, right? Because they're like, do I have to prove how American I am again? Do I have to show up with, whatever? And so we basically said, you can use ID from another country. You can use ID from another state. You can use an expired ID. We just need your name and your date of birth. And so from a policy perspective, we are trying to make sure that we're not creating new barriers for people. Oh, that's funny. I'm sorry. Somebody just brought my dog back. That's why I went off camera, because there was somebody at my door. They were bringing my dog. I didn't even know he got out. They were bringing him back. So
And I'm because I locked the door,
sorry.
trying to figure out how he got in here. So
But yeah, we're trying from a policy perspective not to create new barriers, and to think about how we structure things in a way that addresses those barriers. But we definitely need help with that. So yeah, thanks.
thank you.
Thank you. So I think this has been a really rich discussion. And so before I provide an overview of some things that stood out to me that each of you talked about, I do want to see if I could get maybe Dr. Milner and Dr. Tarabou to maybe share, if they could, about where vaccines are available and just the local process for people to register for vaccines, or if there's some locations that they should be reaching out to.
Yeah, hi, it's Dr. Milner. I usually, and it really is such a challenge. It's one of those, I had somebody just reach out to me yesterday and say, well, I qualify, what do I do? I actually sometimes start with the Ohio Department website. It's like, coronavirus.com or coronavaccine.com, because it's a stop shop where you can put in your zip code until we get the standardized one-stop shop. And it's challenging, and as bad as it's going to sound, we encourage people to sign up for more than one spot. So to Shanina's point, if you're affiliated with a UH, a Metro, or a Cleveland Clinic, yes, register at your hospital partner. But if you don't have access to that, please check the website if you can, or have a relative check the website, and then, exhaust every possible place that you can have access to, even if you're on multiple lists. We honestly, I think that's less of an issue. I say sign up for CVS or Rite Aid and Walgreens. Sign up for what we call our federal health quality partners. So they're like your neighborhood health centers, Care Alliance. Those are all over the city and the county. Certainly the Cuyahoga County Department of Public Health has a website. Cleveland does too. What we did in a meeting last week, which I think is a step from what Jamie said, we actually took a map of Cuyahoga County and actually put push pins in that map for where we had places to get vaccine, but where we were lacking, because that was just as important. As much as we have done in some communities and long-term care facilities, we're missing a segment of the Latino population, right? And now, how many weeks into this are we saying like, oh, hey, we've not gotten to that group as much. So as much as we've gotten to, and I can attest to what Jamie said, like she finds out how much the state's going to get, and then 2 days later, the city and the county find out how much we're going to get, and then we have 2 days to plan what we're going to do with that. I'm going to be on a meeting this Tuesday to talk about the massive pod vaccination. So I am glad to have had this conversation, because there were barriers that I had not thought about that I'm going to share at that meeting as we're planning for that. Because if you think to do that level every day, that's going to present some logistical challenges that we have to be mindful of. One of my favorite ones is always parking. I'm like, you got to be mindful that everybody is not on a bus route. Everybody's not in a car, right? So here's what we're trying to do. We're trying to get shots in arms, but sometimes we have to get shots to arms, right? So everybody can't come to where we're putting up the pods. We really have to be much more creative about getting it out to where people are.
All right, thank you, Dr. Milner. So one question that also would be helpful if you all could answer: what should we expect if we get the vaccine? What are some of the side effects that we might expect if we get the vaccine, so that people, one, to help dispel myths, because one of them is that it's giving you the virus, but also to say, like, if you get this, that that is a normal response.
Right. So I can start, and then if I miss something. So what we can tell you is that there is no live vaccine in any of the COVID vaccinations, right? So a lot of people will say, well, I got a flu shot and I got the flu. You cannot get a COVID infection from getting the COVID vaccine. The effects that people feel are what we expect from not just COVID vaccination, but a number of vaccinations. So arm soreness and tenderness at the site of the injection, feeling body aches, chills, fever, fatigued. Some people have had some GI symptoms. What we do know is that is really not because the vaccine is giving you the illness. It's actually your immune system doing what we want it to do, and that's mount a robust response to that foreign invader. So we expect that. There are things that the vaccine does not do. And when they do the vaccine surveillance, they do look for serious side effects. So I think when the vaccines first came out, there was chatter about, Bell's palsy was a big issue that kept coming up. MS was an issue that came up. So the vaccine does not cause any of those conditions higher than what they expected in the normal population. So you're always going to find some Facebook story or something on the internet somewhere that says the vaccine gave me this or gave me that. It does not do that. The responses that people have, and we can't tell you that's predictable, right? So people are like, well, I'm going to get it really bad after I get the first one, or after the second one, or after both. So we're not able to tell you, yes, the first one's going to be good, the second one's going to be bad, both are going to be good, or both are going to be bad. But the range of what people have experienced is what we've expected from getting the vaccine.
And Dr. Tarabou, I see you, Dr. Knighton. Dr. Tarabou?
Yeah, is it okay if I share? So I just pulled this up on the CCBH website. And if you go there, so there's this tool, this Cuyahoga County vaccination site locator, because it is changing all the time. So you can kind of type in an address, look what's closest to you. I think the big picture to understand is that first, big hospitals got it and were vaccinating their employees, and public health got it, and they were doing healthcare providers as well. And then the pharmacy chains had it, and they were going into the nursing homes. Those were kind of the big providers. But now most of those people have been vaccinated. So now the hospitals are extending it to their patients, and it's going to lots of other places. And as we now have the Johnson & Johnson vaccine, it makes it easier. Some of the in terms of public health, like I was helping vaccinate just this morning, and what I do is I go with a small team, and we see ourselves as kind of plugging holes. And so a lot of times the little group homes are the ones where they don't have a big pharmacy chain, but you have people with developmental delay and they're in a small group home, and we go there and vaccinate them. One of the challenges for homebound people is right now you're not allowed to transport vaccine, like one dose or something. So a lot of those things are kind of being, people are thinking about it. And there's this wonderful equity group at that meets every week at the Cuyahoga County Board of Health. And, just every time there's a discussion, we think of something else that, is making it hard to get to people. And then people work on trying to figure out, well, how do we solve that problem? It really is, it's really serving the community and trying to, get over those barriers. But I think really quickly, or really soon, as was said, the supply is going to increase. And so the difficulty in terms of supply, getting access, is going to be less, but that doesn't mean it's not going to be hard for some people to get it for all the reasons that there are barriers that we've talked about. So we need to keep working on figuring out, like, how do you solve that when someone's homebound and they're just there by themselves? How do you get them one dose of vaccine and make sure the cold chain isn't ruined, right? And if you have a small doctor's office and you've got 10 doses and you poke that vial, you've got to vaccinate people really quickly in a short period of time. So those kind of things are really they're challenges, and logistical challenges, but every day people are solving more of them. But this is a great tool because it keeps expanding where people can find vaccine, and so go to the local health departments, and they're always going to have something there to direct you. And I love the idea of just, when you figure it out, help your neighbor.
Thank you. And the links have been placed in the chat. Dr. Tarabou, if the link to this is not in the chat, if you could put that in the chat, I'd appreciate it. Mm-hmm. So I have, before we close out, I have 3 questions that I'm going to combine into one. And then, whoever wants to take a shot at answering that, if you raise your hand, I'll try to try to catch you better than I did with Dr. Knighton. Dr. Tarabou, if you could stop sharing your screen, so I can see who raises their hand first, that would be helpful. Okay. So the 3 questions that I'm rolling into one. So the first is about the first 2 are about the vaccine. One was about the side effects and whether or not there's anything that you can take to prevent the side effects, particularly with the second round of shots. And the other question is, someone asked when they received their first shot, they were asked about their Latin heritage. And so they wanted to know why they were asked that. Is there any reason they were asked that? So if we could start with that question. And then the last question is the quality of soap and sanitizers. So for example, if you get something from Bath and Body Works, is that the same quality as another type of sanitizer, what they should be looking for in a hand sanitizer? So I'll do this. I'll start with Dr. Knighton to maybe answer the question about the sanitizer. And then if Dr. Tarabou and Milner could answer the question about the vaccines. And then of course, Dr. Knighton, if you want to chime in on that, just keeping in mind that we have 3 minutes left, ladies.
Okay, got it. So really quick, when it comes to fragrance soaps and all of those other things, I know people use them out in terms of preference. There's other things in there that we should probably be thinking about ingredients wise. And I know like many people were hung up on the ingredients in the vaccine. I always bring up the fact that the meat on your plate has a better vaccination schedule than what you do, even though, you know, people are concerned about this one. I also bring up too, when it comes to ingredients in soaps, like things still can be infused into your skin. And so you have to look at the ingredients that these items have. One of the things to pay attention to, antibacterial means that it's against bacterial. It is not antiviral, it is not antifungal. And so a lot of times when we're looking at soaps and we're saying, oh, this is antiviral, I mean, it's antibacterial, coronavirus is a virus. And so we have to understand soap and water works best. You friction 20 to 25 seconds, making sure you're getting the crevices of your hands. Just understand that some of that stuff that's extra ingredients can actually break down your skin barrier as well as cause other issues. I know that it's a preference because they smell good. They're just not one of the things that I recommend when trying to protect against some sort of germ or something that you know may be visibly harming you. Just really quick chiming in about the question that Dr. Milner, I mean, Dr. Milner actually brought it up when she was talking earlier. When thinking about your antibodies and your army and the vaccine itself is eliciting a response in your body that will be less harsh than what your body would be if you encountered the actual virus itself. And so that is the purpose of the vaccine. So when you're thinking about side effects that you are experiencing, even though they're temporary, it is to build up your antibody response against the actual virus itself, should the body encounter it. I have to say that whether we have a vaccine or not, COVID-19 is going to be endemic. There's going to be a certain number of expected cases each year. This vaccine, and Jamie mentioned it earlier, there are strains out there, different things are mutating. It's not as fast as a flu, but are we looking at a potential booster in the future? Are we looking at a more dangerous strain of coronavirus? We don't know. So that's why it's important to keep up prevention. No, there isn't anything that you can take prior to the shot to prevent side effects. I know that there was controversy in regards to pain medicine. I recommend allowing your body to just build up its defense system and its response system without interference of trying to wean off the symptoms. Like let it do what it's supposed to do, because we are finding that there are certain things that people are doing that can lessen the effect of the vaccine. Katie, you muted.
I'm sorry, Dr. Tarabou, when you respond, can you also maybe add in there anything you've learned about pregnant women getting the vaccine?
Sure. Yeah. So, yeah, I just want to second that. You don't want to take anything in prevention, but it is once you maybe if you're not feeling well after your body has responded, if you decide at that point to take some Tylenol to relieve that, that's probably okay. But you don't want to prevent it. Exactly as said. And in terms of pregnant women, well, as far as they did not purposefully include pregnant women in the initial studies, but it turns out some were pregnant, and they all did fine. And the issue is that pregnancy itself can make COVID worse. And also when your baby's born, if the mom gets vaccinated, you have the opportunity to pass some antibodies to that newborn and protect that newborn. So there are a lot of reasons why potentially it, as a pregnant woman, it can really be to your advantage to get vaccine for both you and your newborn. But this is, again, in each individual case, it's a question for your provider. But there is, and right now the studies are being done to look specifically at pregnant women for the different vaccines, because they're all a little bit different. But that's sort of on the whole. And then in terms of if someone was asked if they were Latino, is that correct?
Yes.
Okay, that the reason for that is simply we are keeping track for surveillance purposes of the demographics of who's getting vaccinated, so we can make sure we're reaching people. That's just a way of demonstrating that we're targeting who really is at risk and should get the vaccine, and that we're doing it equitably.
I have to really emphasize that to everyone who's watching. That data collection piece is so critical. Right now, we have like anywhere on any day, like 20 to 30% missing data because folks are not comfortable reporting that data. But just to piggyback on what was just said, it is really important for us to have that so that we know whether we're reaching the right communities. So thank you. Yeah.
All right. The only other thing I want to add that I'm seeing and hearing from the panelists is if you have any symptoms or signs, make sure that you're reporting that to your healthcare provider, and that there are also reporting mechanisms that as consumers you can take as well to report any side effects or adverse effects. And if any of our panelists, specifically Dr. Knighton, if you have any links, please put those in the chat, and I'm also posting those links to Facebook as well. The last thing that I want to say is that, all of this information is informative, but it's really important that you talk to your healthcare provider as you go through this process, and make sure that they're walking beside you through this process, and that you're asking appropriate questions because they have more information about your history, your healthcare history. Dr. Milner, I saw you pop on, so I don't know if you have any additional information you want to respond to with that.
No, I would echo that. I also just wanted to add, because this comes up too, our vaccines being studied in children, those studies are going on right now, because people will ask, when can our kids get vaccinated so they can go back to school? The Pfizer is the only one that's down to age 16. The others are 18 and older, but we are having, even I think there's a primary care practice in the Cleveland area that's actually doing a study on children. So that's ongoing, and we hope that will come to fruition soon. But just stay tuned. But we are working on getting the vaccine available for our younger population.
Well, thank you so much, ladies, for participating in this webinar. We're getting some responses from everyone saying how appreciative they are for sharing this information. The webinar is posted on the National Council of 100 Black Women Greater Cleveland Facebook page, and so it is something that you can share far and wide. So if you have friends and family members that you feel this information would be beneficial to, please share it. This is such an important topic. So thank you again for taking out time on your Saturday afternoon, especially on a beautiful Saturday afternoon, and we wish everybody a great weekend.
Thank you.
Thank you.
Thank you.
Great job, Kat. Thanks for the invite.
Thank you.
Everybody stay safe, please.
Bye.